So here we go, Sarah, week 3 of our theme of the month of interpreters. Just a reminder, folks, we've talked a little bit about interpreters and why use them in healthcare. We also talked last time and mentioned the fact that language is not a protected characteristic, so we covered that. So this time I'm going to talk a little bit about family members. Now, we're aware that different clinicians and their bodies have different thoughts around this, but we're going to talk about the use of family members and why it's discouraged from the physiotherapy perspective. So Sarah, let's talk a little bit about that, some of the concerns. There's lots of things, isn't there, really, if you're using family?
There is, and you can't use children for interpreters, but you are using a family member. So why isn't it a good idea to use a family member? So the things you need to think about: confidentiality. So,
Absolutely.
they don't understand, a family member wouldn't understand the need for confidentiality and might share information with other members of the family.
And they won't have had training in it, will they?
They won't have any
very
training.
unlikely that they'll have had training in it.
Yeah. Do they understand the medical terminology? Do they actually understand what the physio is talking about? Could be a conflict of interest because the carer, if you're a carer, and also the interpreter, it just messes the boundaries around caring for this person if you're the carer for them and then interpreting. So there's a
And it could be biased, couldn't it?
Yeah.
Biased because you're going to be biased in that position. You may feel one way about caring for them, and imagine if you're giving a message that they don't feel is the way they think things should be proceeding.
Yeah, exactly. So there are some really good reasons why you shouldn't use a family member.
And the emotional side of it.
And the emotional side of it as well. Yes, it's very difficult to, when you've got a family member and you're trying to interpret, and it can be quite an emotional experience as well. So next time we're just going to pick up on, if you do use interpreters and use a professional interpreter, how would you go about doing so? We're going to talk about some apps and things that you can use, and also the things that you would need to be prompt and make sure they know about that interpreter before they even see the patient. So that's going to be next time.
Yeah, so go away and have a think about it if you're going to use family members. Okay, bye.
Bye.